In winters, the main change which takes place in the body is that the blood vessels which are in the periphery, because of the cold, they contract. Because they contract, the blood pressure goes up. Because the blood pressure goes up, if there are areas in the brain which are very vulnerable, then those brain areas can be broken down and what we call a stroke can take place. Similarly, in the heart also, because now the heart has to pump harder because the blood vessels are contracted, so the blood pressure has gone up. So even heart attacks, heart failure, the incidence definitely goes up in winters. The other thing which you asked about lung conditions, again, because of the cold breeze, the lungs have a tendency to contract. So people who have lung problems like asthma, like COPD, like old tuberculosis, chronic smokers, all of them will find there is an increased incidence of respiratory problems, respiratory infections. And this is added on with the fact that there is so much pollution which is there at this time of the year. So the pollution also aggravates all these lung conditions, and we advise all patients with lung diseases, etc., to be careful when they step out. If they step out, they should step out during the day when the sun is out, when the pollution levels are slightly lower, and do their exercise. Otherwise, they should take precautions to prevent exposure to the cold and to the pollution. So in winters, what happens is it's called postural hypotension. So if you suddenly stand up, many times you would have found that suddenly there is a second of giddiness which takes place and then your body copes up. So in elderly people who are on medications for heart and for blood pressure, diabetes, etc., the body's mechanism to overcome this sudden change in the pressure dynamics. If you stand up, all the blood will rush down. Your blood vessels in the legs will contract and push the blood back. But there is a time gap in between this happening. And in winters, this is more aggravated. So elderly people or people who are on many drugs, we tell them not to rush. If the bell rings, don't rush there. If you're lying down, sit up. Put your legs down. Wait for a few seconds. Stand up. Wait for a few seconds. That gives your body enough time for it to adapt to this sudden change of dynamics which is taking place, and then you can be back to normal. But if you're in a hurry and you rush, you will hear about people who suddenly they got up to go to the bathroom and they fell down. And the fall down is because of this, because the blood pressure dropped and they did not take the adequate precautions when they went there. No, there are definitely problems. I mean, there is definitely an increase, including in my own practice. I have one patient who has had a brain stroke, one who's had a cardiac problem, and some who have severe lung diseases. They've not needed to be admitted, but we are treating them at home by revising the medication they were taking. Some of them have lung infection because of the pollution in the winters, what we call pneumonia. So we put them on antibiotics, but definitely the incidence has increased.
So what is the age group?
This is all usually in the elderly age group, so that is 50 and above, but also in a younger age group who have pre-existing problems.